everyone. Thank you so much for joining us. We'll just wait a little bit longer. So basically, I'm going to do some fancy stalling here as we let some of our friends in. But my name is Amy Carpenter. I'm the Communications Associate with the Kentucky Resources Council. And for those of you who are not familiar with KRC, we are a 501c3 nonprofit. We are Kentucky's environmental legal defense organization. We provide pro bono legal defense to protect air, water, soil, and just people's health and quality of living throughout the state. This is the very first of our 2022 educational workshops. We are so excited to host this series again. This will be our third year doing so. And this year we begin with Dr. Natasha DeJarnett. We are so happy she is here today. I am going to get into a brief introduction, but before I do, just a few ground rules for today to help make this a seamless and an enjoyable time for everyone. Just please make sure to keep yourself on mute throughout this call. If you have questions, please submit them in the chat to me. There will be a time to do questions at the end of today's session, but just submit them in the chat. I'll collect them as we go and we'll tackle them at the end. If you accidentally get yourself off mute for any reason, I will probably put you back on mute. Do not take that personally. It's just so we can make sure that we have really good audio quality here today. Now, without further ado, I would love to introduce you to Dr. Natasha DeJarnett. She is an assistant professor in the Christina Lee Brown Envirome Institute at the University of Louisville, the Division of Environmental Medicine. She is researching the health impacts of extreme heat exposure and environmental health disparities. In addition, she is a professional lecturer in environmental and occupational health at the George Washington University Milken Institute School of Public Health. Previously, Dr. DeJarnett was Interim Associate Director of Program and Partnership Development at the National Environmental Health Association. She was leading research, climate, and health and children's environmental health. She also previously served as a policy analyst at the American Public Health Association, where she led the natural environment portfolio, including air and water exposures along with climate change. Dr. DeJarnett is a member of the EPA's Children's Health Protection Advisory Committee, is chair of the Governing Board of Citizens Climate Education, a president-elect of the Board of Directors of Physicians for Social Responsibility, chair-elect for APHA's Center for Climate, Health, and Equity, a member of the Board of Trustees for the BTS Center, special advisor to the Environmental Health and Equity Collaborative, and a steering committee member of the International Transformational Resilience Coalition. We are so excited she is here today. I hope you all get as much out of this as I do. And without further ado, I'm going to have Natasha take the floor.
Thank you so much for the kind introduction, and just truly thank you for the exciting opportunity to be here. Hopefully everyone can see these slides. Please do let me know if you can't. Thank you so much. I am so grateful for the opportunity to be here, and thank you, Amy, for inviting me. Now, a list of disclaimers. I will tell you that the information that I have to share with you is heavy, and several times I have been accused of being a Debbie Downer. I will go through the abundant evidence of the health impacts of climate change and how this exacerbates inequities. And for me, hearing this research and data inspires me. It gives me purpose. It lets me know where more work is needed. But some of the stories that I share are heavy. And so for some, hearing this very long list of climate conundrums is depressing, and it may make it seem like the problem is too large to solve. So I will appeal today to those motivated by data, that are motivated by stories, and will work to combat any eco grief that we experience. Climate change is global. We experience it locally and very personally. You see evidence of it in your communities, you experience it in your families, and stories can help bridge the gap that's created by data. And so I will work to share both data. I'm a researcher, so I spend my life in data, but also to work to have data that also meets stories, to fill in some of the gaps and make this a bit more personal. And I hope that this will inspire you to share your own stories as well. So before I delve into climate, health, equity, and justice, I'd love to share with you a little bit about our research center. I'm part of the Christina Lee Brown Envirome Institute, which is in the Division of Environmental Medicine at University of Louisville. And our center fills a void through our framework to understand the environment as a whole through our interactions between the natural, social, and personal domains. And this is what we describe as the Envirome. So to understand how the environment increases or decreases risk of developing heart disease, for example, we must understand the impact of the environment and its specific domains on health. And on the screen, you'll see that I've included the citation of our foundational article, which was published when our center was established in 2018. The Envirome Institute is complete with 7 collaborative research centers, and we partner among and across disciplines and with the community to understand the environmental burdens of disease and identify interventions to improve health and quality of life. So I think I'm talking to friends, like-minded individuals who have a strong handle on environmental health. But just in case, I want to share my definition of environmental health. And this is how the environment around us, our air, our water, our soil, our built features, how this affects human health, how this affects our health. And as we discuss climate change, I thought it would also be helpful for me to share what led me on this path. So it goes back to my childhood. I am a child of the Great Migration, meaning that my parents grew up in the Jim Crow South of Birmingham, Alabama, and moved to points north to find more opportunity. So I grew up in Kentucky, and people of the Great Migration worked really hard to keep strong connections with the family down south, calling or visiting as often as they could. And as such, they made sure that their children had strong bonds with the family, even though we're far away. So I spent a lot of time in Birmingham as a child. Summers, school breaks, holidays, and it was the best of times. I got to play with my cousins, and they're here in these pictures. If you're wondering who I am the child that's not looking at the camera in either photo. I have a blue tie on in the left photo and a red plaid dress on in the right. But we had so much fun running, playing, always outdoors, as you can see here, with not a care in the world. But actually, I did have a care. I noticed at an early age that my very well-controlled asthma would often flare up when I visited Birmingham. And as a child, I noticed I would have to pack extra asthma medication when I would visit, just in case. And these experiences stuck with me, causing me to ask myself, why can't I breathe when I visit Birmingham? So fast forward to graduate school here at University of Louisville. In my environmental health class, we were given an assignment to do a community health assessment, and we could select any community in the US. So I found out that the North Birmingham community where my parents grew up is home to numerous hazardous facilities and had poor air quality. And it must be noted that when my grandparents purchased their homes, housing options in Birmingham were subject to redlining. So they didn't have much choice over what they or their children would be exposed to. Furthermore, I found that the community is riddled with numerous health disparities, present day, low birth weight, cardiovascular disease, and other chronic conditions. So long story short, the place where my family was raised is home to numerous environmental injustices, and there are health impacts that we may still face today because of that. So through this, I found the root of my passion in environmental health, which is justice. I also found my calling in environmental health to be the voice for the voiceless. And now I see this differently. I want to empower the voices of those rendered voiceless. I want to ensure a seat at the table so as to give voice to the voiceless. So the Lancet, the World Health Organization, the American Public Health Association, and leadership of the National Environmental Health Association, and other health societies have declared that climate change is the greatest threat to human health. And to bring further evidence on this, just last fall, over 200 biomedical journals came together to affirm the need for immediate climate action to protect health. So one of the key takeaways I have for you today is a quote from Dr. Ed Maybach. And this is one of those ways of me not leaving you in the dark place. This is the greatest threat to health, but I want to give you some encouragement. So this is a four-part saying from Dr. Ed Maybach, of climate and health communicator at George Mason University. And it's that climate change is real, it's happening now, it's affecting health today, and there's much that we can do about it. It's real, happening now, affecting health today, but there's much that we can do about it. And the important thing that I also want you to keep in mind that I share is that though it's a global phenomenon, climate change is experienced locally. I described to you an air quality burden in Birmingham, Alabama. It's drought in the West, it's vector-borne disease in the Northeast, it's sea level rise along the coast, and the list goes on. So I want you to consider that these differences can be felt certainly in different geographic locations, but also by different population segments and even by neighborhood, as we'll touch on today. And examining the justice aspects of climate change means that we can't look at it in its own bubble. Therefore, I want to point out and share with you that while we face climate change, we're facing multiple health emergencies, and some are exacerbated by climate change, and some confound our response to climate's health threats. So consider these health emergencies: the COVID-19 pandemic, also the racial reckoning, and then we have climate change. And unfortunately, we've seen numerous examples of climate events, in the last year, with extreme weather in Western Kentucky in December, extreme cold in Texas last February, extreme heat in the Pacific Northwest around this time last year, and heat waves along the Eastern US at the same time. Summer 2021 was actually the warmest on record, and Summer 2022 is proving that it may be formidable as well. We also had massive wildfires on the West Coast, and all of these affected health. All of these were in the midst of COVID-19 and the racial reckoning. So Dr. Jelon White Newsom, one of my favorite environmental health heroes and an environmental justice scholar, had this to say connecting our three emergencies of COVID, climate, and the racial reckoning. Across the US, climate change and COVID-19 are playing out in tandem. The warming planet drives increasingly extreme weather, compounding the pandemic's impacts and complicating disaster response. And at the same time, these dual threats have exposed the profound inequities that divide and weaken us. And COVID has laid bare health disparities in the US. Dating back as early as April 2020, we began to notice differences in death rates, particularly for people of color and older adults, fueled by determinants of health and systemic factors, racial disparities in housing, employment, education, and environmental exposures. Data from November 2020 demonstrate some of the lasting impacts of COVID disparities identified in populations of color, where these populations demonstrated up to 4 times increased risk of contracting, being hospitalized for, or dying from COVID. So what I want to share with you that I find interesting is that many of the same populations at risk of COVID also bear a heavier burden of the health threats of climate change. And the health threats are vast. And we are all at risk to the health threats of climate change. I'll say that again. We are all at risk to the health threats of climate change, but some groups are more sensitive to these health threats, and climate change can actually be a threat multiplier for them, exacerbating some of the inequities that these groups already experience. So I'll come back to children in the next slide, but we'll start with older adults. They're more likely to have chronic diseases that may render them more susceptible to the health threats of climate change. Impoverished communities may lack resources to support updates or to recover following an extreme weather event. There are areas that have limited access to needed healthcare services in these communities as well. Communities of color are most likely to live on the fence lines of industrial polluters, and the strongest predictor of where hazardous polluters are located is race. It's not income, it's not education or other factors, it's race. People of color make up the majority of people living within 3 kilometers of a hazardous waste facility. Indigenous communities have close cultural and religious ties to the land, and climate is affecting their ability to hunt and gather food from the land and pass on religious and cultural traditions. When there is a threat of extreme weather, people have better health outcomes the sooner and further that they can evacuate to safety. However, people living with a disability may have challenges in evacuating safely if there are mobility challenges. Undocumented residents may not feel comfortable evacuating to a shelter following an extreme weather event for fear of deportation. And similarly, members of the LGBTQ community may not feel comfortable evacuating to shelters for fear of discrimination or worse. I share these unique burdens faced by these populations because we cannot truly address climate change if our most vulnerable don't benefit from action. Therefore, we can't meaningfully address climate change without addressing justice. Even our most well-intentioned efforts to address climate change will be undermined if justice isn't at the center. Children suffer disproportionately from the health impacts from climate change. This is an injustice. This is a generational justice issue. But I will say this, I am so inspired by our youth. They are raising their voice. They are not waiting for others to raise their concerns for them. I joined a group of youth that are part of Schools for Climate Action who organize meetings with their congresspeople on Capitol Hill to call for action on this generational injustice. And this is a great example of giving voice to the voiceless. And so there are a number of reasons why children are uniquely susceptible. Children's organ systems are still developing, so exposure in sensitive times of development can have long or short-term consequences. They breathe in more air or drink more water for their body weight, which leaves them more exposed compared to adults. Children are dependent on adults to make decisions for their well-being. They crawl on the ground. They have these hand-to-mouth behaviors that put them at greater risk of exposure to ground level pollutants or for ingesting toxins. And lastly, they can be exposed through chemical exposures that can travel through the breast milk or those that can cross the placenta. So I will briefly step through these threats and expose some of the inequities that are born or exacerbated by them. So we all deserve clean air to breathe. And the Frameworks Institute did research on how to communicate about environmental health, and their research identified that communicating in terms of values can actually help bridge a gap. So I start with a value statement. We all deserve clean air to breathe. And climate change is decreasing the quality of the air that we breathe. It's increasing carbon dioxide levels in the atmosphere, trapping heat and pollutants below like a blanket traps heat. This extra pollution decreases our air quality, but this extra trapped heat further reduces our air quality. And climate change promotes drought conditions, which creates environments that are conducive to wildfires, which we're well aware had devastating effects in the West Coast last year. And those wildfires last summer were so strong and so intense that we were exposed to the wildfire smoke here in Kentucky. I remember about a week and a half in Louisville that we had poor air quality related to the wildfire smoke. So the smoke from wildfires, that decreases our air quality as wildfires emit particulate matter. The warmer temperatures are resulting in a longer pollen season, and research suggests that increased carbon dioxide is also increasing the intensity of this pollen. So we have a longer and more intense pollen season, which is bad news for allergy sufferers. And another allergen that we can be exposed to is mold, which can result after flooding in our homes, schools, or workplaces. So poor air quality is associated with increased risk of heart and lung disease. And with the intensifying pollen season, we also have the increased likelihood of allergy symptoms. And all of this is more than just a nuisance. Both asthma and allergies increase the likelihood of school and work absences or even decreased productivity. So there's been a lot of attention drawn towards redlining right now, where we now understand that formerly redlined communities have been identified to have worse air pollution disparities, hotter surface temperatures, less tree cover, worse health outcomes. This particular study I'm showing here was featured in the Washington Post earlier this year. But let's just step a little bit closer and share with you some of the health links. So associations between historical redlining and emergency department visits are shown here in this ecological study across California. And so you'll note in the top maps, the red shading indicates the highest level or highest risk level or redlined areas. So the red shading are the redlined areas. And then you'll see in the maps below where those areas correspond almost directly with the locations shaded with increasing intensity of purple to mark a higher rate of emergency room visits for asthma. So this demonstrates that the formerly redlined areas have a higher burden of asthma in these cities across California. So I'm going to share some about COVID as well. We don't experience climate or COVID separately, and there are intersections here where climate change makes COVID more deadly and COVID complicates disaster response. So in the first maps, research from Dr. Francesca Dominici and her team at Harvard demonstrated that cities with higher pollution have higher COVID mortality. In addition, their research suggests that even a 1 unit increase in PM 2.5 is associated with an 8% increase in COVID-19 death rate, meaning that more polluted cities have more COVID mortality. And Brandt and others lay out a case for further investigation between the relationship between air pollution and COVID-19 mortality disparities by race. And I share this because this warrants a need for more understanding of the disproportionate burden on air quality and COVID mortality. So I'm going to share with you a short case study. Now, a disclaimer, I am not sharing this to be disparaging of any federal agency, but there was a regulatory pause, or there was a pause on the regulation of environmental releases that was from roughly March through August of 2020. This provides an opportunity for a natural experiment to examine the relationship between air pollution and COVID. As I said, this is not meant to be disparaging. We know that much of the public health workforce was called into COVID action. At the time I was working at the National Environmental Health Association, we surveyed our workforce in March of 2020 and found that at that point, already half of the environmental health workforce was called into action. So that certainly leaves less people to support these types of roles. But then there was also the safety of the workers to consider. This is a disease where people cannot be around people. And we knew very little about COVID at that time. So again, that's my disclaimer. This is not meant to be disparaging, but this created a sort of natural experiment that we can learn from about COVID and air quality. So Dr. Claudia Prosecco and her team at American University shared results potentially linking COVID and air pollution during the regulatory pause. And they found that during the regulatory pause, there were higher levels of PM 2.5 and ozone. They also found higher COVID deaths. Further, they found disparities where this relationship was more exacerbated in counties that had a higher percentage of African Americans. And so this drove a hypothesis that counties with higher toxic releases may have higher COVID rates. So they looked at the EPA's toxic release inventory, which is available to all of us, accessible online. And so they looked at this toxic release inventory of releases in counties across the US provided by EPA and found that communities with more toxic release inventory sites had higher increases in pollution during this regulatory pause. They also found that counties with more toxic release inventory sites had more COVID-19 deaths during this regulatory pause. So their data suggests a positive association with the number of toxic release inventory sites and COVID deaths, suggesting once more that higher pollution is linked with more COVID mortality. So there are many things that are taking place across the nation to adapt to the health impacts of climate change. So I'll end each of these impacts by sharing some examples with you. I'm really proud to share one of our examples here in Louisville at University of Louisville, and that's the Green Heart Project. And this is a project that's supported by the National Institute of Environmental Health Sciences and the Nature Conservancy, along with several other partners and the community. And this is a randomized controlled trial where trees are the intervention. We are planting trees and shrubs for healthier air, and we examine the health indicators and air quality levels before and after tree planting. So tree planting started in October of 2021, and it continues today. So Green Heart therefore provides an opportunity to establish roots as a greener neighborhood. Other adaptation actions that happen in our communities include air quality testing, dissemination of any air quality alerts if there's a breach, or enforcing air quality regulations, which we have seen can be difficult given some circumstances. So climate change has increased the severity, frequency, and duration of extreme heat events. And this is especially concerning because extreme heat is the top cause of natural weather-related death in the US. Extreme heat increases our risk of heat-related illness, including heat stroke, which can be deadly if not addressed quickly. It raises our risk of heart and lung complications. And further, there are mental health impacts, including increased violence and aggression under extreme heat conditions. As well, extreme heat can render inactive some psychotropic medications. Populations that are sensitive to extreme heat include older adults. As I said, they are more likely to have chronic disease, but they're also more likely to be socially isolated and may not be aware when there is a heat event and that they need to seek safety. Children may spend more time outdoors. They don't really know when they've overdone it. They don't have that capacity to know that they've overdone it, need to cool off, come inside, take a cold drink. So they can be quite susceptible as well. Communities of color and impoverished communities are more likely to live in urban heat islands, and the EPA has reported that urban heat islands can be 20 degrees hotter at night than their surrounding areas. People who work outdoors in construction, agriculture, they also bear an additional burden when it comes to extreme heat exposure. So heat waves increase mortality risk, and the Chicago heat wave provides a powerful case study. The Chicago heat wave isn't just about heat. It's about inequities. It's about structural racism that further multiplies the health threats of certain populations, largely based on where they live, which is largely associated with their race and ethnicity. In this particular heat wave, the death rates fell along trends of the communities of color and older adults. For further information, I highly recommend this documentary that's called Cooked, which is available freely online. I was a part of a panel that watched Cooked and had to respond to Cooked. And I am not overstating it by saying that watching Cooked changed my life. So these are some statistics from the Chicago heat wave. In this first graph, the blue shading indicates the time of the heat wave, July 11th through 27th, 1995. And on the graph, you'll see the average deaths are in orange. So that's the average deaths over the whole decade. So that's what you would expect to see. The red line indicates the heat-related deaths in 1995. And you can certainly see where those spike during the heat wave period. The green dotted line indicates the temperatures. And so you can also see that the red spike corresponds largely with the increased temperatures during this heat wave. So the table to the right illustrates the disproportionate impact that the heat wave had on mortality among the elderly. Race and ethnicity specific rates increased steadily with age, and people 65 or older accounted for 63% of all deaths in 1994. That's the year prior to the heat wave. The same group accounted for 72% of the heat-related deaths that occurred during this heat wave. So it was certainly the experience was intensified among older adults as well as people of color. So what do heat exposure disparities look like 20 years later? So in this first table, the CDC's Climate for Health program reported on heat-related deaths in the US, and they demonstrated that whites or Caucasians have the highest deaths, the highest number of deaths, but American Indians had the highest death rate. And so I wanted to highlight some populations that are uniquely susceptible to heat, including American Indian Alaska Natives. In addition, another population that is susceptible here are non-US citizens. This study examined, in this second image, this study examined deaths by citizenship status. And they reported that 96% of heat-related deaths were among non-US citizens, while only 4% of the deaths were among US citizens. So because of this stark difference, you may not have realized that you're seeing a bar graph between the 96% and the 4%, highlighting a key population that is susceptible to heat-related death in a time where extreme heat exposure is increasing. So what's happening here in Kentucky? So here I put a spotlight on Louisville. Climate Central measured summer temperatures in 60 largest cities identified by metropolitan population size. And from that, they determined that Louisville has the 5th most intense urban heat islands, the 6th most intense overnight urban heat islands, the 6th most days above 90 degrees compared to our rural areas, and the 4th fastest growing urban heat islands. And I've actually seen more recent data that puts Louisville at first for fastest growing heat island effect. So this is why I study the impact of heat on heart disease risk here in Louisville, Kentucky. But there are many actions that are taking place to address extreme heat. And this includes things like I shared before, increased green infrastructure, or increased vegetation like trees. So tree planting or increased vegetation is happening, and there are many examples across the world where this is taking place. Other factors include cool roofs, utilizing roofs that reflect heat rather than absorb heat. Certainly, there's a lot of education that's taking place so that sensitive populations know to avoid spending extended time outdoors on heat alert days, disseminating alerts far and wide. Another thing that's important is assuring cooling center access. Not just that these are in our communities, but that people know they're in our communities and people can access them. Are they on the bus routes, for example? Are they easily accessible? Surveillance and assessing our vulnerabilities are other things that take place in the field as well. So changing gears to extreme weather. With the increased carbon dioxide in the atmosphere, this is increasing surface water temperatures, making the frequency and intensity of extreme weather events both more frequent and more extreme. So 2017 was a record-breaking year for hurricanes, with hurricanes Harvey, Irma, and Maria all making landfall on the US. And then insert 2020, more named storms to make landfall than ever here. So the photos here show Hurricane Harvey's youngest victims, and children are especially susceptible to extreme weather because they often rely on others for their decision-making and care, leaving them especially vulnerable immediately after emergencies like flash flooding. So they're not able to make decisions to protect their health and safety, and this also leaves them at risk for physical injury and even death. So we'll go through our first of our extreme weather case studies, and that's Hurricane Harvey. So the injustice with exposure to these storms often lies in the recovery. So resource-rich communities can return to normal quickly. Meanwhile, communities of color and low-income communities in Houston were still working to rebuild a year later. And because of the industrial area was in closer proximity to these communities of color and low-income populations, insert redlining, racial segregation, they were far more susceptible when those industries flooded, leaving contamination to breach into their drinking water supply. So just a couple of weeks ago, news broke that the Department of Housing and Urban Development has identified that there was discrimination against African American and Hispanic residents in the allocation of flood relief money following Hurricane Harvey. And then there's Hurricane Katrina. Hurricane Katrina is our most costly and most deadly hurricane to reach the US. So I'll share with you briefly about a case study on Hurricane Katrina, and think about the mental toll as you hear this. Severity of Hurricane Katrina was far exceeded by the considerable destruction, devastation, displacement, and death left in its aftermath. Some residents trapped in their homes escaped to their roofs to await rescue. From there, they watched as the remains of their neighbors, of loved ones, floated through the flooded streets. Some families were separated into different places of refuge. Over 1 million people were displaced. Nearly 2,000 died, and thousands were left traumatized. And those that remained were unable to access basic resources such as schools, shelters, and emergency services. Survivors had to cope with profound loss, disrupted social ties, and resulting surges in violence. Mental health services were not widely available. Thus, years later, the psychological scars caused by Hurricane Katrina continue to linger. The impacts of extreme weather not only threaten our physical health, but also our mental wellness and well-being. And so the data shows that nearly half of Hurricane Katrina survivors developed a mood or anxiety disorder, and 1 in 6 developed PTSD. So actions to protect health in extreme weather include disseminating alerts early and often, and ensuring evacuation access, like evacuation shelters and transportation to them. But I will note that COVID has complicated disaster response due to our need to socially distance. So in some of the recent storms, some jurisdictions were not able to open storm shelters or even provide transportation to evacuate, further complicating disaster response. So climate change causes increased flooding on one hand and increased drought on the other. So when we have a heavy flooding event, this can cause our stormwater to overflow our superwater, causing contamination in our drinking supply. One study reports that half of waterborne disease outbreaks were preceded by a heavy rainfall event. And with drought, we also see impacts to health. We see impacts to agriculture, like decreased crop yield, decreased quality of our crops, and this can be linked with malnutrition. So there are a number of populations that are uniquely burdened by drought. Communities with close ties to the land, like agricultural and indigenous communities, they bear a higher social and economic burden of drought. Rural communities, or those that are reliant on smaller private drinking water, may be particularly at risk when there's limited access to water in the ongoing threat of drought. And then there's also a growing body of evidence that drought exacerbates chronic conditions like kidney disease, diabetes, and hypertension. So I am going to share my family's story with you on our experience with flooding. I shared this story first through the Citizens Climate Lobby's International Conference in a storytelling session. So give me just a couple minutes to share our experience. It was late on a Saturday night, and Dad, Mom, and I were leaving the home of our family friends a few miles from our home in Georgetown, Kentucky. It was extremely dark, but we could see that it had rained because the street looked a little wet and the grass had some rain droplets on it. But we were all smiles as we hopped in the car, reminiscing on the new memories that we created with our friends. And then we started our drive home. Within less than a minute, I heard my dad say from the driver's seat, "I can't see the road anymore." Within seconds, we figured out why, as the front tires splashed in the water, then the rear tires. The tires were quickly submerged and the water crept up. I heard the car's engine go from a strong hum to a low, deep growl. The water was starting to seep in the car and it was puddling beneath our feet. Panic set in. We couldn't turn around. In fact, Dad no longer had full control of the car. We began to seek desperately for solutions. I looked out the rear passenger window beside me, but instead of solutions, I saw my 12-year-old reflection. On the other side of the window, I saw the water creeping up. In my reflection, it was at my chin. Panic turned into fear. Then the water was at the same level as my nose. Fear turned into terror when I saw the water go over my head in my reflection. We were terrified. This was an entire family in a car, a dad, a mom, and their only child, and all of our hopes and dreams facing the immediate threat of death. As we watched desperately for a solution, we noticed a driveway nearby. That was our only hope. And somehow the flood waters guided us to that driveway, and Dad was able to regain control of the car and turn the car and drive up the driveway. From there, we watched the flood waters for hours until 3 a.m. They were higher than the mailbox at that house. And we were mostly silent during that time, but I am certain that we were individually sending up prayers of thanks to God for surviving the impossible. The next day, we shared the story with our friends, and they explained that that happens every time there's a heavy downpour, saying that you can't get in or out of their neighborhood when this happens. They even shared their similar experience of being trapped in floodwaters on the same street with their small kids in car seats. Mom and I were on that street recently, and she pointed out a cross on the side of the road near our incident. And she explained that a woman had gotten trapped in the floodwaters a couple weeks before and didn't make it. They found her car the next day. Climate change is causing more frequent and more intense flooding events. These increase our risk of injury, illness, and death. Floods can leave behind mold in our schools and workplaces, and floodwaters can contaminate our drinking and recreational waters. This puts communities like that of our friends in Georgetown at greater risk. But adaptation activities can help protect us from the immediate dangers. For example, environmental health practitioners can work with planners to make flood-prone communities more resilient. Environmental health practitioners can develop vulnerability assessments to identify areas at greater risk. They can team with planners to incorporate designs that better handle stormwater runoff, including developing greenways to protect streams and floodplains, allowing for stormwater to soak into the ground. I don't know why my family was spared that night. Perhaps for this moment, for me to put a human face on climate change, for me to share the urgency of action needed to protect our communities and our families who are filled with hopes and dreams of a bright future. I've heard it said by many environmental health leaders that we're the first generation to feel the health impacts of climate change and the last that can do something about it. But there is much that we can do about it. And we can do it with the skills and expertise of the environmental health workforce and those partnering with researchers across disciplines and with communities. So that's my story. And I think in that story, there were a lot of examples of things that are being done to address flooding, like assessing water quality, issuing water advisories when needed, but also restricting developing in flood-prone areas, having designs that better handle stormwater runoff, relocating buildings or roads that repeatedly flood, and also, once again, green infrastructure. So the last of the impacts that we'll cover is vectorborne disease. And climate change increases the amount and geographic distribution of disease-carrying mosquitoes and ticks. As such, we're seeing increases in Lyme disease, West Nile virus, and Zika here in the US. Vulnerable populations or populations that are more sensitive can include pregnant people, where exposure to Zika virus during pregnancy raises the risk for microcephaly. Children are also uniquely susceptible. They spend more time outdoors, so they may have more opportunity for exposure. And then there are also people that work outdoors that also bear a heavier burden when it comes to vector-borne disease. So the Lancet Countdown on Climate and Health US brief reported that there was a tripling in vector-borne illness from mosquitoes, ticks, and fleas when comparing 2004 to 2016, including diseases like Lyme disease, West Nile, and Zika virus. But there are many things that are being done. Public health professionals are educating physicians that they may see more vector-borne disease in their clinics, equipping them to educate their patients, I should say, to wear insect repellents, cover skin, eradicate areas of standing water that are in our yards. Vector control is also a means for controlling vector-borne disease, as well as integrated pest management. When we go beyond simply vector control, but understanding the life cycle of the pests and work to interrupt in the places where they may habitat most. So as I shared, climate change not only threatens our physical health, but our mental health as well. And exposure to extreme weather and floods can increase the risk of stress, anxiety, post-traumatic stress disorder, and depression. And extreme heat or extreme weather can increase risk of depression, violence, suicide, and suicidal ideation. And again, it can even render inactive some mental health medications. So as I round out, I return to the faces of the children in Birmingham, Alabama. And after I began sharing my story of asthma flare-ups when I visited Birmingham, my aunt shared with me that her daughter, my cousin, which is the little girl in the jean jacket here, had the same experiences. And she shared that when their family moved away from Birmingham, her daughter's asthma, which was quite advanced, practically vanished. No one should have to move to have healthier air and healthier lives. And this is why I work to equip decision makers and regulators with the information needed to protect communities. This is why I work to empower communities, giving voice to the voiceless. So thank you for your time today. Please be well, stay safe. I'm happy to take any questions you may have. And here is my contact information.
Thank you so much. That was absolutely wonderful and informative and also emotional. So, so thank you for combining and bringing that intersection of heart and mind to this really important topic. We do have a couple of questions that have been previously submitted. So if you're okay answering a couple. The first that was submitted was, can people be motivated to act, to take some responsibility in trying to turn what is currently inevitable around?
Yes, I firmly believe that people can be motivated to act. This work would be very hard to do if I didn't feel that people could be motivated to act. And so I think that as people experience climate events personally, that certainly can be a motivating factor. So you'll see that there are a lot of people that try to communicate about these impacts when there are climate events and connect that to health. And we also think that health is a way to motivate people to act. We have often spoken, and I poked a little bit of fun at this in my slide. We've often spoken about climate change in terms of polar bears and ice caps. These are important, and in many cases, these were the canary in the coal mine to let us know that something is going wrong. However, we found over the years that that's not all inclusive in terms of motivating people to act. And people can feel very distant when it comes to polar bears and ice caps, but they feel very compelled when it's themselves, their family, and maybe their community. So making it personal and connecting it to health can be a good bridge in this conversation and motivating people. And then the other thing for me is finding a space of like-minded individuals. That has been eye-opening, helpful, has helped build me up and helped me to see that if it feels too big for me, as an individual, that as a part of a group, we can make large change. And so I am an active member of a lot of organizations that are working to address climate change. The American Public Health Association's environment section, this is probably where I learned and cut my teeth on climate change and health. So that gave me access to more knowledge and education and helped me to connect with other professionals who helped me connect with other professionals around this topic, and felt like I wasn't on my own or by myself. I'm also a member of Physicians for Social Responsibility, where I serve on the board of directors. That gives me more community in this space. And then also I'm board chair of Citizens Climate Education. And that just continues to give me access to armies of people that are highly motivated and working to act. So they help combat the eco grief aspect of this, make this seem much more attainable. So yes, I think that people can be motivated to act. And as such, I think we should surround ourselves with others that are like-minded to help keep us encouraged, but also keep us educated and informed. And that a large group we can all make a difference. And I don't want to say one person can make a difference, but a large group can have a larger impact than one voice alone. And so I think all of those can come together, but I think that discussing climate through health can help bridge the gap with some that may have not engaged quite as much before, making it really personal, making it plain. But health can be a motivator and really can be a bridge divider. Oftentimes, I'll tell people, I work on climate change, and I'll see the eyes glaze over immediately. And then I make those health connections, and people will say, I never thought of that. And I absolutely love when someone tells me, I never thought of that.
Thank you. Then those were some wonderful organizations to encourage people to check out as well. Our second question, and you touched on this in your discussion, but I just wanted to lift it up just in case there was anything else you wanted to add to it. Are there subsets of Kentuckians who will be more affected by climate change than others?
Absolutely. So yes, our older adults and our children, for the reasons that I stated. But here in Kentucky, we should also be concerned for people that have close economic ties to the land, and how flooding and drought can affect those close economic ties to the land. There's a study on farmers in the Midwest that there was a massive drought that occurred during the 80s over multiple years. And they found that the number of farmer suicides increased during this period. So we need to be very closely in tune and understand the concerns of those with very close ties to the land, social economic ties to the land. So those are a few of the key populations, in addition to all of the populations listed before. We can see examples of those unique vulnerabilities right here in our state as well.
Thank you. And we have two more questions if you have time. The first question is, and I'm going to include their commentary as well, because I don't want to misrepresent anything. I regret that I don't sense that most policymakers experience heat-related problems themselves, so don't take them seriously. I ask myself how to get their attention. Ribbon cutting seem to be a top prize for elected officials. Are you aware of any research quantifying the economic impact of heat-related illnesses and efforts to prevent them on the cost of constructing major infrastructure projects, like the political treasure of roads and bridges?
Ooh, the connection of infrastructure and extreme heat exposure. Very interesting. Now, off the top of my head, I can't say that I am aware, but I have some directions that I can point you that might have some research or evidence around the topic. I know that Dr. Vijay Lamay and Dr. Kim Knowlton of Columbia and the Natural Resources Defense Council, they have done quite a bit of research on the economic impacts of climate change. So they may have some insight that can help shed some light in this space. But I think that's a powerful question. I think that understanding that during this time would be extremely timely and relevant. Thank you.
Well, thank you. And we'll definitely pull up that research and try to find some things that maybe align with that question. And if we do, we'll definitely send that out to participants today. And the last question that we have submitted, and this comes from a point you made in your discussion, can you give an example of how heat stress can change psychoactive medication functions?
Oh, yes. So, if we look at our product labels on our medications, it says that it's only effective from this temperature to this temperature. Those are the temperatures that it has been tested at in its effectiveness. Exceeding that in extreme heat, the research has shown that, particularly for psychotropic medications, this has rendered them inactive. Thanks for asking about that.
Well, thank you for bringing that up. I may be alone in my thinking, but at least for me personally, I had never even considered heat stress also on medication.
Yes.
Just one more reason to be really, really motivated.
Absolutely. Thank you.
Yeah. Well, thank you so much for your time. Thank you everyone who joined us today. And thank you to those who will be watching this later on this afternoon as well. We once again are so thankful that you made the time to deliver that great information and just really explain and highlight how climate change can impact our personal health as well, and why it's so important for us all to make the efforts that we can to really make noticeable gains for environmental justice. So thank you so much. Thank you, everyone. If you have any questions, please feel free to reach out to us at any time. We'll try to connect you with information that you need to do good work. And we'll hopefully connect with you all later in the future.